Look up leech in the dictionary and you'll find a couple of definitions. The most common, parasite. Less common, doctor. That's right, doctor. And here's why.
These blood-sucking worms don't look like they belong in a hospital. But for some patients undergoing reconstructive surgery, leeches are their last and best hope. Dr. Matthew Concannon, a plastic surgeon at the University of Missouri at Columbia Medical Center, says that in some cases, leeches are the only way to prevent the loss of a limb.
Typically, when leeches are applied, that's the last-ditch effort to try and save whatever you're working on.
Here's a dramatic example. Blood began pooling in this woman's left hand after an injury. The engorged limb swelled to nearly 5 times its size. That's when doctors began leech therapy. Home video captured the dramatic change.
That's come up.
After only 2 days of leeching, it already looks better.
Is your hand any better today?
5 days later, the color is returning, and her limbs decreased in size. A month later, it's nearly normal. Her wedding ring even fits. That's because leeches keep blood from pooling in damaged areas. That allows tiny veins to reconnect and begin draining the area naturally.
It's only when things go wrong that they turn to leeches, and most of the time they save the day.
And today they're not widely used, except in surgery when a body part is being reattached. Carl Peters runs BioFarm, the oldest leech breeding lab in the world.
These leeches here are quite hungry.
Every year, BioFarm ships 20 to 30,000 leeches to hospitals around the world.
My initial reaction to seeing leeches used in a hospital was I was a little queasy. We're using basically bait, fish bait, to apply a treatment to a patient.
But that so-called bait can do what no surgeon can, regardless of their skill level. Just ask Justin Page. 3 years ago, a dog bit the Missouri boy's ear completely in half.
When I first met Justin, his ear was nearly completely severed, and basically told the parents we'd take him to the operating room and try to repair this if we could.
But this type of microsurgery is a very delicate procedure. It's not just a matter of sewing the ear back on. Dr. Concannon has to use all his skill to reconnect an artery that's only 1/3 of a millimeter wide.
We were able to reconnect that artery, but there was no veins available to reconnect.
That means blood is pumping into the damaged area, and if it stays there, Justin will lose his ear.
So at this point, we have blood going in, and we know now that we need to start the leech therapy.
It's never easy to ask parents if you can attach bloodthirsty leeches to their son, but that is exactly what Dr. Concannon did.
I was nervous when he said that, and I got all scared.
I was leery just because of the word leeches.
After getting the go-ahead, a blue foam donut was set up around Justin's ear. Then 2 starving leeches took hold. Justin didn't feel the bloodsuckers bite because their saliva contains a natural painkiller which numbs the area. Then 300 tiny teeth go to work.
When the leech bites, it has three jaws which are in a Y shape.
During a typical 20-minute feeding, a leech can take in 5 times its weight in blood. When they're done, the bloated worms fall off on their own.
The larger the part, the more you need to leach it because there's more of a blood supply that needs to be reestablished.
After 10 days of leech therapy, the tiny veins in Justin's ear have mended. 3 years later, his ear is as healthy as before.
Nothing is as effective as a leech. If we didn't have leeches, I would not have been able to save Justin's ear.
The largest of these bloodsuckers can grow up to 18 inches long.